Right, so the cosmetic surgery is very popular among the younger generation. So from people 18 to 30, and it's not uncommon for them to want either breast augmentation or some liposuction, and also rhinoplasty, nasal surgery is very common among young people. Some of those rhinoplasties are associated with breathing problems. So not all of it is necessarily straight cosmetic, but some of it functional. But many times if they can change the shape of the nose at the same time as make it breathe better, then might as well. I would say probably about half my practice is in the younger group. They're fun, they're eager. Sometimes they've got something where they've been teased about their nose, or they've got some extra fat around their neck or abdomen, and so we can take care of that pretty easily. A number of the women want to fit better into a swimsuit or look better in their clothes, so those are issues that we can deal with quite easily for the younger patient. So it's not all necessarily facelifts on older patients. A good portion of our practice is younger patients. The ratio between male and female as far as cosmetic surgery is concerned is mostly female. So it's probably 80 to 90% female. And it's a ratio that really hasn't changed over the years, even with the promotion of hair transplants and eyelid lifts for men. Men usually come in because they need to be competitive in their field, or they're concerned about male pattern baldness, or looking older or aged. Maybe they've lost a spouse. So those are the things that affect why men would come in for cosmetic surgery more than women. Well, most patients who come in for cosmetic surgery really fall into two categories. They want to enhance or make themselves look younger. And so those patients are going to be in their 40s, 50s, and 60s. Other patients want cosmetic surgery to affect a structural problem. So it becomes more related to the aesthetic balance of the face. So maybe their cheeks need augmentation, maybe they have too much of fat around their hips or their abdomen. So then it becomes more of a shape issue rather than a rejuvenation surgery. Right, well, with anything, cosmetic surgery is always a cost issue, and many patients who are younger won't necessarily have the resources. But fortunately, we have the ability through some of our companies who we work with, we can arrange financing for them. So we can make it affordable. We also have an operating room here that's licensed, and we have board-certified anesthesiologists. So we can manage the costs for them from an overall package standpoint too, which a lot of surgeons aren't able to do. I love taking care of patients in that younger age group because they recognize that they have an issue. Usually they're young and healthy, so the surgery's not risky. And they're eager to get it done. Usually it's bothered them for a while. So it's a fun group, and I love taking care of them.